August Sadly and regrettably, we've seen more COVID-19 related deaths, bringing the number of fatalities here to 36 today. Our sympathies are extended to those grieving the loss of loved ones at this time. The message must go out loud and clear to the whole community to stay at home in order to stop the spread of this deadly virus and to protect lives and to take pressure off the health service. Most people are complying with this advice and the law, and while it's an anxious and stressful time for everyone, these measures are vital, as is social distancing. Yesterday, viewers heard from the Chief Scientific Officer, Professor Ian Young, on the recent modelling. According to the data, in the reasonable worst-case scenario, the health service here would have a realistic prospect of coping with the initial wave of COVID-19 cases. Under this scenario, with hospital admissions for COVID-19 running at a peak of 500 per week, it is estimated the peak number of those people whose lives would be lost would be 3,000 over 20 weeks. This is a very sobering statistic. We expect to hit the peak number of cases between the 6th and 20th of April, and Belfast City Hospital has been transformed into our first Nightingale Hospital as part of the surge plans. This will become a 230-bed unit for critically ill patients, staffed by a team drawn from across the health service. £140 million already has been supplied to the Department of Health for COVID-19 measures, including the purchase of tests. I have been working closely with the Health Minister to procure PPE and other supplies based on the needs identified by them, and we are pursuing leads with both the Irish and British governments. The scale of the pandemic we face means this will necessitate multiple orders containing a range of products from a variety of suppliers. Can I say it's no secret that I believe that we should have been testing much more and much sooner than we are. I'm glad that has been ramped up now, and I look forward to that being done very quickly. We have, in relation to PPE, as well as taking the supply that has come through NHS in England and trying to secure some supply from that which we hope in the coming days. But we've also, as a regional authority and having our own autonomy, reached out to procure supplies from elsewhere. And I think in relation to testing, it doesn't seem to me to be logical that we have a company 10 miles from here making tests, and the proposition is then to ship those to England and redistribute them back to us. So I think we need to ensure that we can secure sufficient tests for our purposes. I think we need to continue to ramp that up. The first and primary focus of that is to protect health service workers, to ensure that health service workers can return as quickly to the front line, because the modelling that was talked about yesterday and we referred to today will only work if we have health service staff to cope with the demands that are going to be placed on them. They can't be there if they're isolating because they're assuming that they may or may not have COVID-19. So that needs to happen very quickly. We're late to the game in relation to this. We need to very quickly speed ourselves up and catch up.